Welcome back. I visit clinics all around Europe for you, so if you like what I do, make sure to like and subscribe. Today we're visiting CEFER Clinic in beautiful Barcelona.
We made it. Let's go inside.
It was founded in 1977 as country's first sperm bank and has been pioneering reproductive medicine ever since, including developing ROPA method for female couples. So let's see what the clinic actually feels like. As I entered the clinic, I was welcomed by the lovely team at the reception desk, and I was given a tablet to fill in all my information to proceed with the consultation. The waiting area was quite cozy and it gives you some privacy. So the first part of the journey when you arrive at the clinic, once you filled in your information, you will have a sit down with a patient coordinator where they walk you through all the documents, all the necessary information, all the pricings, everything that you need to know before you actually get started. Once you're done with that part, you'll head for your testing. So we start off with a blood test, and it's for both the female as well as male, because CEFER Clinic wants to have a good insight into the health of both sides, which is one of the reasons why they analyze the male factor very thoroughly. So your journey will involve an andrology consultation, as you can see here. Then, once all your testing is done, your andrology consultation is done, you're ready for your medical consultation, where everything is analyzed and the protocol is set up for your specific case. My medical consultation was with Dr. Markus Nitzschke, specialist in cases of low ovarian reserve and a pioneer in Europe of natural cycle IVF and minimal stimulation IVF. At the end of our consultation, I got to ask him why patients choose CEFER Clinic.
Patients choose CEFER if they fail in other clinics, right? Because CEFER is not a clinic that has a high visibility on the internet. This is a clinic that has not a strong marketing team and not a strong brand positioning. So patients are usually choosing the clinics that are more visible, like Eugene, like Markus, like EV, and other clinics that are present, that go to international fairs, that have this visibility, which is fine and which works for many patients, right? Because the whole structure is made for this. But high complexity cases, for example, they may fail in these clinics because they don't focus so much on the depth of the case. They are more focusing on the actual patient experience, and here is where CEFER comes in. Patients who fail in other clinics because of several reasons, because they may not have focused on the male part, they have other medical problems that interfere with the case and with the pregnancy rate, and these factors are not really taken care of. These cases then eventually end up with us after a long journey, and I mean we can in many cases we cannot add a lot of other alternatives, but we can really focus on the problems, try to solve them, and we can really try to convert this whole thing into a success. This is what we are doing on the regular basis. The cases that we see are very intense in all kind of ways, psychologically, medically, and that's why we are also focusing on the personal relationship with the patients. Patients who come here are followed from A to Z by the doctors and by the medical team, not by a coordinator, which is extremely unique in this landscape of clinics here in Spain.
During your medical consultation, you will also go through an ultrasound and an examination. Now let's take a quick peek into the room where the man leaves their sample. So you have everything you need. You can also come in with your partner here, and there's a little window where you press a button and you leave your sample, and it's collected by the embryologist or the nurse. Now here we have a separate waiting area for the procedures. So there's a nurse station and 3 rooms where you prepare for your egg collection or transfer. The rooms are directly connected to the surgery room. Now let's prepare to go and see the embryology lab. We were lucky enough to get a tour from the embryologist and the director of the CEFER clinic, Dr. Fernando Marina.
We perform here the embryo thawing and the embryo freezing, and outside an embryo freezing and thawing. And in this cabin, we perform the sperm samples. Okay. This is the capacitation and cryobiology room. And we enter here to the IVF lab. You can find here the sandwich incubators and also the time-lapse incubator. Okay. And here perform to cabin in order to perform the ICSI procedures and pick up and harvest outside. And in this place we have the theater. Okay.
So this is where the magic happens. And this is what it would look like when you would be brought from the prep room into the theater.
Okay, normally the pickup is performed here, the pickup and also the embryo transfer. Okay. And after they finish, they go out to the respective resting room, and after that go out. This is the cryobiologist area. We have here the sperm banks, the Voyager in order to send sperm sample to other centers, and this is the embryo and oocyte storage. Okay, we have a temperature control for all the tanks. Okay, and this is a very important part of the lab. This is the cryobiologist system. Okay, we have a lot of sample here. Hello, this is the time-lapse incubator. This is incubator that we can show all the culture without taking out of the incubator the embryos, because they have a system that making picture every 15 minutes, so we can see during 5 days of culture all the evolution of the embryo. Also, this incubator allows us to apply an algorithm for embryo selection that is like predict that introduce a system that we can set and give a score to the embryos in order to select the best, the high quality embryo and with the highest score of this algorithm of here.
I also had the pleasure to visit the DiNA Science Lab, the genetic lab that CEFER uses for their genetic testing.
I am Carlos Gimenéz from DiNA Science. I'm one of the lab directors. And here in DiNA Science, we perform mainly analysis of genetic analysis applied in human reproduction. So our main focus is PGT, but also expanded carrier screening. So here in our lab, we have nowadays most of the things are done in the computer. So we have a huge area of where the analysts work. So and we have different labs for different purposes. Here we have the sequencers. The sequencers where we do mainly the PGT cases. So we carry out here PGTA, PGTSR, and soon we are going to do also PGTM in these sequencers. The samples arrive to us. We make some general job in the lab, and then we sequence the DNA in these machines. The first area is one of the most important areas where we do the amplification of the DNA. Not the amplification, we do all the preparation we need to carry out the amplification of the DNA. So it has to be a clean area. So this is probably the most important area in the lab. And then here we have Laura and Susana that they are preparing some samples to carry out PGTM. So now they are doing all the previous work before we go to the array system. Then, so there is the amplification. Here is the preparation of the samples, the analysis in the machine, and then everything goes to the computers where the people watch the data that comes from the machines. We have other areas that, but they are mainly for administration of the lab. And we have an area similar to this one where the people doing carrier screening works. One of the most important things that we do for our clients is that we are very accessible to them. So whenever they have any problem, they can pick up telephone, call us, and we are always on the other side of the telephone. So we think that this is the way we have to do, because genetics is being difficult and difficult because the science advance very fast. We try to put this in a simple words in order our clients can serve the better for the patient.
Thank you so much.
Thanks to you.
So we're back. And that was CEFER Clinic, a clinic with an incredible history and years of experience behind them. As you could see, it's a cozy clinic with friendly staff where the doctors are the main drivers in the patient journey. It's quite different from how clinics usually handle the patient journey, which I really appreciate that they are doing something differently, something that works for them and have their own way of looking at the patient experience. The genetics lab they use was really impressive. Their own embryology lab was really well equipped. And I believe that having senior embryologist as the person who manages the clinic makes a difference, as he's able to approach it from a very scientific medical background. I believe that CEFER Clinic will be a good choice for a variety of patients. Dr. Markus has a broad experience in natural IVF. The clinic is also well experienced in PGT. They accept patients over the age of 50 and up to the age of 55, which is quite rare in Spain. So if you're looking for egg donation program or you want lower medicated cycle, CEFER may be a great choice and may be able to offer you things that you are not able to find elsewhere. If you liked this video and would like to see more clinics reviewed, make sure to hit like and subscribe buttons below. And every time you do that, you allow other people to be able to find this video and decide whether CEFER Clinic is the right choice for them. And if you're looking for an IVF treatment abroad, you can reach me and my team at Behind IVF Clinic Doors directly using the information in the description below. You can find our social media channels there. I'll see you soon.